CORTAIR belongs to the group of respiratory system medications and is supplied in cardboard packages containing 20 single-dose vials. Each vial contains 2 milliliters of a whitish suspension and is intended for single use only. The active ingredient of the medicine is budesonide. You can find the list of excipients contained in the medicine in the final part of the video. The information you will hear in this video has been prepared based on the medicine's package leaflet in order to inform CORTAIR users. If you find this video useful, please don't forget to like the video, join the channel, and turn on notifications for support. What is CORTAIR and what is it used for? CORTAIR belongs to a group of medicines known as glucocorticosteroids and is used to reduce inflammation. Asthma is a disease that occurs as a result of inflammation in the airways. CORTAIR is used at all stages of asthma to reduce inflammation, widen the airways, control disease symptoms, and reduce the need for orally administered steroids. CORTAIR is also used in the treatment of croup in infants and children, which is caused by viral infections, develops rapidly, and may sometimes require hospitalization. How is CORTAIR used? CORTAIR is used by inhalation with the help of an inhalation device. The vials are gently twisted open and the contents are poured into the nebulizer chamber. Opened vials must be used within 12 hours. When breathing through the face mask of the device, the medicine reaches the lungs through the airways. The medicine should be used regularly as prescribed by your doctor. The dose of CORTAIR varies depending on the patient's condition. Always use the medicine exactly as recommended by your doctor. CORTAIR should not be used with ultrasonic nebulizers. After each dose, the mouth should be rinsed with water, and if a face mask was used, the face should be washed. The initial dose in children aged 6 months and older is 0.25 to 0.5 milligrams per day. In adults and elderly patients, the daily dose is 1 to 2 milligrams. The maintenance dose in children is 0.25 to 2 milligrams per day. In adults, the maintenance dose ranges from 0.5 to 4 milligrams per day. For the treatment of croup, a total daily dose of 2 milligrams is used in infants and children. This dose may be given as a single dose or as 1 milligram followed by another 1 milligram 30 minutes later. The full effect of the medicine occurs within 2 to 4 weeks. Do not stop the treatment even if you feel better. What should be known before using CORTAIR? If you are allergic to budesonide or any of the excipients of the medicine, the use of this product is not recommended. Do not use CORTAIR without consulting your doctor if you have a lung infection, cold, chest infection, breathing difficulties, tuberculosis, liver disease, or vision problems. If you feel short of breath or experience wheezing while using CORTAIR, continue using the medicine, but consult your doctor as soon as possible. If your breathing worsens, if you wake up frequently at night due to asthma, if you feel chest tightness in the morning, or if this tightness lasts longer than usual, these symptoms indicate that your asthma is not adequately controlled. In such cases, it is recommended to consult a doctor as soon as possible. In some situations, special caution is required when using CORTAIR. Be sure to inform your doctor about any recent infections or liver diseases you have had. CORTAIR may interact with certain medicines. Medicines used to treat fungal infections, steroid-containing medicines, and medicines used in HIV treatment may interact with CORTAIR. If you are using any of these medicines, be sure to inform your doctor. Budesonide passes into breast milk. However, no adverse effects are expected in breastfed children at therapeutic doses. CORTAIR may be used during pregnancy and breastfeeding only upon the recommendation of a doctor. Possible side effects of CORTAIR. CORTAIR is generally well tolerated. However, some people may experience side effects. Oral thrush, hoarseness, and throat irritation may occur. Rinsing the mouth with water after each dose reduces this risk. With long-term and high-dose use, growth retardation, decreased bone density, rounding of the face, increased intraocular pressure, and rarely, mood changes may occur. In patients with COPD, the use of inhaled corticosteroids may increase the risk of lung infections. If you found this video useful, please don't forget to like the video and subscribe to the channel. You can share your opinions and experiences related to medication use in the comments section. Stay healthy.